Physician health and wellness is one of the key priorities for the SMA, and a perennial feature of the RA is a presentation on health and wellness. And today, we are very excited to be hearing from Tracy Danelishan Laycock, the Director of Physician Wellness and Support Programs, and Jessica Richardson, the Clinical Coordinator of the Physician Health Program. And their presentation is entitled Physician Health Risk Factors, Being Human and the Cost of Providing Care, Prioritizing Physician Wellness. Please join me in welcoming Tracy and Jessica to the stage.
We're assembling our team here. Our team has been growing, and we're going to have an opportunity to introduce you to the entire team at the end of our, or in the middle of our presentation rather, but as they're making their way up here. My name is Jessica Richardson, and as mentioned, I'm the Clinical Coordinator for the Physician Health Program, and I'm based out of the Regina office. I hope everyone enjoyed their walk with Doc and had a wonderful lunch. My goal is not to put you to sleep, so I hope that you guys feel energized now and not ready for a nap. So we'll see how we do. So medicine can be a profoundly rewarding profession, and we know that it can come at a cost. So first and foremost, I want to thank all of you that are here today and for all of the amazing work that you have been doing and that you continue to do. Today, we're going to spend time honoring some of your experiences and impacts that caring for other people has had on you as physicians. My goal today is to discuss the cost and explore ways of easing the burden of caring on physicians. We've heard a lot about this already this morning, and I think that it's not anything new that has come across your minds, but hopefully we can think together on how we can move forward in terms of health and healing and creating that really healthy system that you guys are all seeking. I think there's some great plans that are coming forward, but we are really sensing this urgency to change things immediately. While that change is happening, it's so important for physicians to be able to care for themselves, and that's where our team is going to come in to try and help support that. Click the green button. Okay. Burnout, compassion, fatigue, and moral injury. These aren't new concepts. These aren't new terms, and you are all familiar. Unfortunately, many of you have or are experiencing these. The 2021 CMA National Physician Health Survey found that over half, at 53% of physicians, reported experiencing symptoms of burnout. That's 1.7 times higher than the pre-pandemic rate. Feelings of depersonalization were at 58%, compared to 35% pre-pandemic. 1/4, or 25%, of physicians reported to experience high to moderate levels of anxiety, and nearly half, at 48%, of physicians reported to be experiencing depression. 36 of those people, 36% rather, reported to experience thoughts of suicide or self-harm at some time in their life. And 14% of those people had thoughts in the past 12 months. So we know that this is something that is having a significant impact, and we need to start doing interventions now to help care for physicians. Also from the Physician Health Survey, the National Physician Health Survey from the CMA, 1 in 5 respondents reporting to be experiencing moral injury or distress frequently. I want to present a case study to you. Kate is a 41-year-old psychiatrist who covers an inpatient ward at 2 hospitals in the city. She's a mother of 4 boys, ages 5, 7, and has 10-year-old twins who happen to all be involved in hockey and lacrosse. Kate's really busy already. Kate tries to coordinate her kids' activities around her patients, but she often finds that she's running late and has to rely on some other parents to help and pick up her children. Her husband is also very supportive, and he's involved. He has a busy career too as an architect and is often out of town working, and unfortunately that leaves Kate to manage their lives as best as she can. Kate often gets called in the middle of the night from residents and nurses about her more difficult patients, and she can't remember the last time that she got a full night's sleep. When she's not being called by the hospital at night, she's up thinking about all the things that she's forgotten to do or the meetings that are coming up for the week. On top of her own caseload, she knows that she might be taking on more work, and that's probably very likely because 2 of the psychiatrists are going to be leaving the department. When Kate was in with patients, she listened to them tell stories about how stressed out they are, working a 9-to-5 job with no additional burden that's being placed upon them. She silently wishes that she could trade places with them because they don't really know how good they have it. Recently, the family took a vacation, and while on vacation, she found that her thoughts were preoccupied with everything that was going on at work and what she might be returning home to, and she was sporadically checking her EMR while on vacation. When she got back, she didn't feel like she had a vacation at all. She is tired of running around after the kids. She's tired of being late. She's tired of all the additional paperwork that she has to fill out. She recently questioned her career path and whether she made the right decision. She doesn't feel like she has enough time in the day to meet all the demands on her. She feels guilty about the time away from her children. She feels guilty about the care that she's providing to her patients. She questions whether she is making a difference in people's lives at all. Although she would never do it, she sometimes fantasizes about walking away from everything or going to sleep and never waking up so that she wouldn't have to deal with everything that's going on in her life. Kate is experiencing burnout. Burnout is a work-related disorder. This occurs when people are overcapacitated with the significant demands of their working environment, and it has a psychological impact. It's distressing. There is disharmony between work, life, there isn't any balance, and it takes time away from their personal lives. The distress doesn't improve when people have had time off or have had time away. Burnout can result in that physical exhaustion. We can experience mood alterations, decreased satisfaction in work. Relationships can suffer, and that's both personally and professionally. People become more irritable, cynical, negative, maybe unempathetic, and it challenges people's confidence and their self-esteem because they're trying to do so much with so few resources. And we know that time is such a valuable resource. There are certain risk factors and personal characteristics that have called physicians into the profession, and this aids them in being amazing physicians, but it can also be a detriment to them as well. And it can lead to these injuries, and this is true for all of the different components that we're going to be talking about. That need for perfectionism, constantly striving to be perfect, but to what end? And being perfect isn't leaving any room to be human. We're all human, right? We all make mistakes, or we all have these other perceived things that are going on in our lives that we have to tend to. We can't be all in all the time. Control and perfectionism can take away from meaningful work and overseeing tasks that may be able to be delegated from to other people. So that's an example of maybe that perfectionism that is taking over the care that you're providing. Over-dedication to others is that desire to be liked and that willingness to sacrifice pieces of yourself to meet other people's needs. But what happens when there's nothing left to give? There's a high emotional investment in medicine, and we know this. But I want you to remember that medicine is what you do and not who you are. It makes sense about that high emotional investment because the journey to become a physician has been grueling and has required a significant investment in terms of time, energy, money, relationships. There's so much that you've had to give to be able to get to where you are. But of course, that's only a small part of your identity. It's a sum of the part, not a whole. So consider what other aspects make up that whole. If there is ever a time in your life where you aren't able to practice medicine, maybe illness, injury, working part-time, or moving into retirement, what are you retiring into? What's the other whole part? And start investing in those aspects. The delay of gratification, we see this in lots of different ways. I'll be happy when. I'll be good enough when. I can rest when. I can finish this research project and then I can tend to all these other things that are going in my life. And we also see this in the physical aspects where we aren't honoring our humanness in terms of holding your bladder hostage, for example, not having time for a lunch break or a water break. We're not tending to our human needs in those instances. There's a quote from Sean Acker in the book called Feeling Seen, which was written by Jodie Carrington. She's a psychologist in Alberta. And it says that the most successful people, the ones with a competitive edge, don't look to happiness as some distant reward for their achievements. nor grind through their days on neutral or negative. They are the ones who capitalize on the positive and reap the rewards at every turn. We know that burnout is a systemic issue and it is a public health crisis, and we've heard a lot about that this morning. The system factors that contribute to burnout aren't new to you. There's that mismatch in control in terms of autonomy in your own workload, lack of appreciation or appropriate rewards, and that's not just in remuneration. There's rewards in value, feeling appreciation, having time off, and of course that financial aspect provides the opportunity to have those other components in life in terms of the time off, so it's important, but it's not the only thing. We need to return to the why of medicine and promote a healthy system for physicians to be able to engage in that way. The loss of positive connections in the workplace are seen in the toxic work environments. It can be really easy to point out the bad and not always as easy to point out the good things that are going on as well. And it's infectious. So ask, what way are you contributing to your work environment? And is there a way that you can flip the script? There's a perceived lack of fairness, and there can be lots of different examples of this. The one that comes to my mind might be the delegation of resources, for example. And then conflict between values is working in a system that isn't set up to equip the physicians to provide care in a way that reflects their own beliefs and values. And that can result in a moral injury, which we're going to explore. I have another scenario for you. A case study. This is David. David is a physician practicing in the ER for the last 5 years in an urban center. He has always loved the fast pace of the ER and the diversity of the patients that he gets to work with. Over the last 3 months, David has had 3 incidents involving either the death or a serious injury of a child. The first incident happened in early May when a family of 5 was heading to the lake and their car was hit by a semi. 2 young children were taken to hospital, and unfortunately one of them passed away. David was involved in that child's care. The family was devastated and very angry that David did not try hard enough to save their baby. The second incident occurred over the July long weekend when a young 6-year-old girl fell into her aunt's pool when she was unsupervised. She was rushed to the hospital and she passed away shortly after arriving. David was also involved in that child's intervention. It wasn't long after these 2 events that David started to feel sick to his stomach. He struggled to get out of bed in time to make it for his shift in the morning. He noticed that he was starting to feel apprehensive about seeing younger patients. His partner also noted that David seemed to be more irritable, he was tired, and he wasn't interested in participating in the running group that he used to love. His partner also noticed a hypervigilance where David was exhibiting over his young children. He was fearful that something terrible was going to happen to them. His sleep was disrupted. He often woke up at nighttime having nightmares and would be checking the children to make sure that they're okay. When David was at his next shift and it was near the end of the day, a 6-month-old baby was brought into the emergency department, covered in bruises and barely breathing. The father wouldn't disclose how the infant sustained the injuries. David became very angry. He started yelling at the man in the examination room. A nurse overheard the interaction and intervened. The incident was reported to the ER department director and the safety reporting line. A colleague of David's approached him and suggested that he take some time off to deal with whatever was bothering him, as his actions were not normal for him. David was able to speak to his family physician, who suggested counseling and medication. David is experiencing compassion fatigue. Compassion fatigue is the impact of caring for others and witnessing their suffering. There is a desire to relieve the suffering of others, and in medicine, that's a key component to providing care. Caring for others and their physical and emotional pain can weigh heavily on the hearts and souls of physicians. It is also known as vicarious or secondary trauma, where witnessing somebody else's trauma can become their own. When this occurs, physicians feel worn down and they can struggle to connect empathy with patients. This is actually a protection factor because of the significant emotional distress. You've heard of the fight, flight, and freeze response, a stress response. There's actually fawn is attached to that as well. And that's the brain's way of protecting from that significant emotional distress. Fawn, think of deer in headlights. You feel paralyzed, you're disconnected, you dissociate, and that's your brain's way of shielding you from the significant distress. Compassion fatigue can also increase the anxiety, in which there's hyper-awareness or hypervigilance and worrying that something negative is going to happen. Repeated exposure of the trauma leads to compassion fatigue and often alters physicians' ability to feel compassion. Burnout doesn't. While burnout does lead to depersonalization with patients, doesn't necessarily interfere with the ability to connect with other people in your life. A stressful and negative work environment causes burnout, whereas the impact of caring causes compassion fatigue. The onset separates the two conditions as well, whereas compassion fatigue is usually right after a traumatic event or shortly thereafter, whereas burnout is an accumulation over time with those workplace stressors. And the impact of compassion fatigue is evident in every aspect of people's lives, as you can see on the slide. From the cognitive perspective, it's that perfectionism or the preoccupation of trauma in terms of the nightmares or flashbacks or continuing to ruminate on what had happened. There's emotional distress, behavioral changes or disturbances in terms of maybe not sleeping or waking up, having nightmares, withdrawal, isolation, impatience, irritability. There's the physical aspects in terms of the somatic complaints. So that's the pain that you feel in your body, the discomfort in your body. In terms of relational aspects, it's isolating, withdrawing, when we actually need to move into our relationships instead of moving away from them. And then from a spiritual standpoint, it's that loss of purpose or meaning, loss of satisfaction, and not feeling that what you do is making a difference at all. Similar to burnout, there are personal characteristics that are risk factors in experiencing compassion fatigue. And one of note is that previous exposure to trauma. When someone has been traumatized, any future event can be re-triggering of the initial event. If we were to think of in terms of someone's capacity to be able to manage stress, when you've been traumatized, you're at the top of your capacity, and it doesn't take much to push you over or re-trigger the event. And that's actually something that people need assistance with to be able to process, to be able to heal from, to be able to move through. And sometimes you can do that on your own, but there's a lot of times where we need other people to support us in doing that. And whether that's family, friends, or trusted others, or reaching out to other professionals, that's really important. And we're going to move into shortly the things that we can do about all of the stuff. But before we do that, I want to go through one more scenario with you. So this is Ahmed. He's a 50-year-old general internist working on a medicine ward, again in an urban center, for the past decade. The hospital is overcrowded, and we know this, we've heard about this already, and that's only been amplified post-pandemic. Although there are sick people in the units that Ahmed covers, almost a quarter of his patients are considered to be blocking beds due to their either behaviors, lack of housing, or addictions issues. Ahmed tries to discharge his patients as fast as he can to help with the system flow issues. However, he's struggling with the decision to send patients home without the proper supports in place. Many of the patients need further convalescence, but there's nowhere to send the patients for short-term rehab. And as a result, the patients go home and wait for community therapy, which can have a significant wait list as well. The latest intervention is for physicians to discharge patients who need long-term care to their home, to wait there rather than waiting in the hospital. Unfortunately, while Ahmed was away at a conference, one of his patients were discharged, and it wasn't something that he had agreed to. The 95-year-old patient with dementia fell and hit her head and died within 24 hours of returning home. The family is very upset and threatening to sue Ahmed and the hospital for their mother's death. Ahmed is devastated as a result of this particular death, and also very upset with hospital administrators for sending patients home for long-term care when they were not safe to do so. Ahmed is seriously questioning whether or not he can work within a system that doesn't support patient-centered care. He's losing sleep. He's anxious, he's feeling disengaged with his patient load, and his wife is worried that Ahmed will end up leaving his job and wanting to uproot his family and move overseas. Ahmed is experiencing a moral injury. Physicians take an oath to do no harm, and at times there are systemic challenges that impede the ability to care for patients in a way that aligns with your own personal morals and beliefs. When a moral injury occurs, physicians have been pushed to consider the needs of the system over the standard care of their patient. When physicians are forced to make decisions and go against their patient's best interest, it's a sting to the moral justice, and over time that accumulates and becomes to a moral injury. The impact on physicians can result in feelings of guilt, shame, low self-esteem, high self-criticism. Physicians might struggle to empathize with others, or they may experience an existential or spiritual crisis that collides with their beliefs and values. This can lead to self-destructive behaviors, sometimes the use of unhealthy coping strategies, whether that's alcohol or other substances, which actually makes things worse instead of better. They might make drastic changes or make rash decisions in those moments as well. They can also lead to PTSD, depression, anxiety, insomnia. And the significant stress of the clash of values can also lead to thoughts of suicide or self-harm. So what do we do about all this? We know it's an issue. I know that unfortunately so many people have been experiencing it or are experiencing it. And if we were to look at it from an individual and a systemic approach, from an individual perspective, first and foremost, and this covers all areas in terms of compassion, fatigue, moral injury, and burnout. We need to extend permission first, permission to tend to your own needs. The system is focused on patient first, and we want to disrupt that system and put physicians first. When physicians are healthy, they are more equipped to be able to care for their patients in a way that aligns with their morals and values, in a way that patients probably want as well too. There's permission for self-care, permission for boundaries, permission for connection, and extending permission for yourself is compassion. Sometimes it's easier to extend compassion to other people than it is for ourselves. So if that's something that you're having a hard time with, I want you to consider what you would tell someone that you care about or another loved one. And I want you to harness that for yourself and give it to you. Having healthy boundaries is finding balance in all things. And I think that's probably my slogan, my catchphrase that I say to so many people. We need balance in all things. We need to have work-life harmony. This means finding balance in the hours at work, the dedication to work, and having things to go to home to. We talked earlier about that identity piece. So what are those things that you can invest in on the grander scale of things? You need space to be able to engage in other things, other aspects of your life. Practicing in a way that aligns with your values and advocating for change when it doesn't. This is also a boundary that we can have. And if we're noticing that there's unsafe work environments, then it's calling that out and advocating for that too. Self-care. We can never talk enough about self-care, and this looks different for everybody. Self-care is the foundation of resiliency, and people take care of themselves in different ways, and not only in terms of how you take care of your body, in terms of the physical aspects, and giving yourself permission to have a bathroom break while you're in the middle of a shift, but also in terms of having downtime for rest and relaxation, having those social connections and fostering those relationships too, outside of medicine, immersing in nature, immersing in mindfulness, using stress management coping strategies. These are all self-care things that will help move things further in the future and help create that foundation of health. We've talked a lot about social connections, and that's not only an aspect of health, but in terms of receiving support too. Who are your trusted others? And if we need support in processing and healing from a traumatic event, then sometimes we need those trusted people to help support us in doing that. So we also need to know when to seek support. And so whether or not that's support from our family or friends or from trusted professionals, colleagues, the physician health program for one, we're going to introduce the team here shortly. But first we're going to go through the system strategies that I think that you guys are on to something. There's been a lot of great conversation today in terms of trying to manage the crisis, the healthcare crisis that's going on right now. And this is the opportunity to challenge the unhealthy system. And I commend everybody in this room for being willing to step up and advocate for that and be the disruptors and highlight the areas that need change. Knowing what your role is within the larger system can give you direction on how to manage it. Returning to what is in your control. Sometimes we feel like there's nothing in our control, but we always have something in our control, and that's us first and foremost. But considering whether or not you're a large stakeholder, if you report to somebody or if you have many people that report to you, there are certain things that remain in your control. So if you have power to change it, then I encourage you to work towards it. If you have the power to challenge it, then I encourage you to do so thoughtfully and respectfully. If you don't have the authority to change something, you can advocate for change. You can challenge the unhealthy culture at a macro level, but also from a micro level too, in terms of those interactions and the relationships that we have with people at work. The bottom line is prioritizing the care of physicians, tending to your own needs, and putting you first, whether that's independently or through accessing supports from trusted others. So with that, I'm going to turn it over to Tracy, and she's going to introduce our resources that are available to you as well.
Thank you, Jessica. One thing I want to add in before I do introduce the team in terms of what Jessica's talking about is self-care, and that's physical self-care. So within our team, we have what's called the Caring for Our Own program. So I know that there's many physicians across Saskatchewan that don't have a family physician. So we actually have a two-way process. We have a list in both Saskatoon and Regina, in the southern and the northern part of this province, a list of physicians that are willing to take colleagues. So if you do not have a family physician, please reach out to Jessica for Regina in that area and Lorraine in Saskatoon, and she can help you. On the other end, if you are a family physician and you do have time and room, which I know many of you don't, but if you are interested in being a part of that program and providing family medicine services to your colleagues, please let Jessica, myself, or Lorraine know, and we can help your physician colleagues. So just wanted to add that in. So, who am I? Well, I'm honored to be here today for my first Spring 2023 RA as the new Director of Physician Wellness and Support Programs for SMA. Where do I come from? Well, prior to coming over to SMA, I was a Director of Continuing Care within the SHA for the 17 long-term care homes in the Transitional Care Unit at Saskatoon City Hospital. So I'll put that in bed numbers. So I had 1,700 beds plus 40 at TCU. It was a heck of a job. Prior to that role, I was a behavioral consultant for the former 30 Saskatoon Health Region long-term care homes. I have a master's degree in anti-oppressive counseling from Dalhousie University, as well as a PhD in health sciences through the College of Medicine. My research areas are leadership, facilitation, and sustainability of evidence-based practice in healthcare settings. So I feel that those collection of skills and experience make me a great director at the SMA. And I really do appreciate Bonnie taking the chance on me, so thank you, Bonnie. I will be supporting in this new role the Physician Health Program, the Workplace Wellness Team, the Medical Benevolence Society, and working with Dr. Nambuka for the EDI. Please do not hesitate to reach out to me for any support that you may need. Before I introduce the team members that you see in front of you today, I would like to acknowledge the work and the innovation of Ms. Brenda Singer. Although she's not here today, she's provided support to many SMA members over her 20-year career, and she will be missed by many of us in this room. I thank her for everything that she's done for the physicians, residents, and students, and the staff at the SMA. Brenda will continue to work over her 2 days a week as clinical coordinator within the PHP program until the end of December with her current existing clients. So now, turning over to this team. So Jessica, as you've all met, and Lorraine, who some of you may or may not know, they will continue their work with the Physician Health Program. This program provides assistance to the SMA members and their immediate families who may be struggling with issues such as burnout, stress, addictions, or relationship issues. The program provides assessment, treatment, education, counseling, and coaching, and so much more. This program helps physicians and their families so they can continue and have an effective medical practice. Jessica provides support to the southern part of the province and is located in the Regina SMA office, and Lorraine in Saskatoon. So if you or your family need help, please do not hesitate to reach out to them for confidential support. So in April of 2023, the SMA hired 2 new half-time physician advocates, Dr. Benga Adebayo and Dr. James Chen. So if you can, Dr. Chen, if you can just wave, and Dr. Adebayo. And we also have 2 full-time workplace wellness consultants, Jarrett Sodden, and Blaine Nienaber, who is not here today, to support the workplace wellness work that Brenda has done. Dr. Adebayo is a family physician in Prince Albert who graduated with a bachelor's degree in medicine and surgery from Nigeria. He worked as a general practitioner for 4 years before moving to Canada. In 2014, Dr. Adebayo completed the Masters of Public Health program at the U of S. Dr. Adebayo is passionate about holistic healthcare and disease prevention, primarily through community-oriented collaborative approaches, which I think is what we heard this morning as the new model of care. He believed these approaches help people thrive and optimize their capabilities, especially for his physician colleagues, to maintain a work-life balance and to prevent burnout. Dr. Adebayo will be located in the Saskatoon SMA office half-time and will provide support to the northern part of the province. Dr. James Chen completed his medical school and residency in Saskatchewan and has been practicing in general adult psychiatry in Regina for many years. He set up the Regina Mental Wellness Clinic, which now has a large group of psychiatrists. Dr. Chen currently works mostly in the outpatient setting with significant past experience in acute care and hospital psychiatry. He is involved with the medical education of clerks and residents. He sees a variety of patients with covering mood and anxiety disorders, psychotic disorders, personality disorders, substance use disorders, ADHD, and his list goes on. Dr. Chen will be situated in the Regina office half-time and will provide services in the southern portion of the province with Jarrett. So Jarrett, he recently moved to Regina after an 18-year stint to the United Kingdom, where he wore several senior management hats in organizational health, wellness, and private healthcare. His leadership experience spans across the delivery, operations, client services, marketing, and business development. Jarrett has a wide-ranging experience in workplace investigations and conflict resolution. In 2021, he completed an accredited mediator program in the UK. He holds diplomas and certificates in massage therapy, occupational health, disability management, and nursing, so he's a jack of all trades. Jarrett is located in the Regina SMA office and will work conjointly with Dr. Chen supporting the southern part of the province. And finally, for the workplace wellness team, Blaine Nienamer. He will start his new career within the SMA on Monday, May 15th of 2023. Blaine is a registered nurse with a bachelor's degree in nursing from the University of Saskatchewan. He brings with him over 25 years of experience in leadership, management, and clinical roles in both long-term care and acute care in both rural and urban centers across Saskatchewan. So during his career, Blaine worked as a clinical nurse educator and manager at the St. Mary's Villa in Humboldt, as well as behavioral consultant with the behavior support team in the Saskatoon long-term care homes. He is currently the director of nursing at the Bethany Pioneer Lodge in Middle Lake, not Meadow, and he will be working with Dr. Bayo in the Saskatoon SMA office, providing services to the northern part of the province. So this team will work with the SMA members who are experiencing challenging or unsupportive environments and may provide SMA members with assistance when they are in conflict with coworkers, departments, or other outside stakeholders through conflict mediation, resolution work, or advocacy, among many things. If you need these services, please feel free to reach out to any one of these 4 individuals and they will help you walk through and support you in whatever ways that you need. So we all know Dr. Nambuka. He's the physician advocate for equity, diversity, and inclusion at the SMA. This position promotes and advocates for equity, diversity, and inclusion on behalf of the individual SMA members and the profession as a whole. He leads the development of SMA initiatives that promote and advance EDI best practices and serves as a primary contact and resource for SMA members to access support when faced with racism, prejudice, bias, or inequity. As physician advocate for EDI, Dr. Nambuka collaborates with the Physician Health Program and the Workplace Wellness Team to formulate interventions for members, as well as providing support, conflict resolution, advocacy with agency, case management, and ongoing support. And finally, I would like to introduce Priscilla Bam. Often behind the scenes, she's our administrative support for our staff and programs that I mentioned earlier today. Priscilla has been with the SMA for over 8 years and has worked closely with Brenda Singer within the Physician Health Program. Priscilla provides administrative support to the Physician Health Program and to the EDI committees, among many of her other roles. Priscilla is currently supporting the development of the EDI conference on September 22nd of 2023, as well as the redevelopment of the Physician Health Program Wellness Hub on the SMA website. So Priscilla, you're the glue that keeps us together and the one that'll keep us all on track. So if anything is going astray, reach out to Priscilla, she'll fix it. So if you require assistance for the Physician Health Program, the Medical Benevolence Society, the Workplace Wellness Team, or Dr. Nambuka, please visit the Physician Support profile on the SMA website for further information. So please, everyone, join me in welcoming Dr. Adebayo, Drs. Chen, Dr. Nambuka, Lorraine, Priscilla, and Jarrett to our team. So now I believe we have Dr. Nambuka, unless there are questions for our team.
Thank you so much to Tracy and Jessica and the rest of the team. I think I can say for all of us that we feel a tremendous amount of support here from this group and appreciate all your work.